Hi, I'm Simone Walker and I'm one of the Deputy Secretaries here at the Department of Communities and Justice.
Hi, I'm Renata Field and I'm from Domestic Violence New South Wales. Wherever we are, we'd like to acknowledge that we're meeting on the lands of Aboriginal people and pay our respects to elders past, present and emerging.
Thanks, Renata. We thought that this was a really great opportunity for us to get together with DV New South Wales and talk about some of the things that we know the sector is concerned about and some of the things that we have in place to support yourselves and your staff. So we're really happy to take questions about what we talk about today and follow those up with further videos. But we hope this will provide you with some additional information.
Thanks so much, Simone. So I'll start with a couple of the questions we've had from providers. What can providers do to prepare for possible increases of domestic and family violence and to get more support?
So the government's mobilising quickly, and I think that a number of the providers will know about stimulus packages that have been coming from both the state and from the federal government. So we'll be providing additional information about what sits in those packages as it becomes clearer. We know that in the state government we have additional information about temporary accommodation as well as rental packages that will support the DV sector and also women and children leaving domestic violence. It's really important at this time for services to keep in regular contact with their contract manager. That's a really great way for us to measure and notice what trends are occurring, where there are increases, and where there are increases in complexity, which is some of the feedback that we've had from the sector. What I want to do is make sure that people have a sense of permission about working differently in this environment. It will be harder for services to do face-to-face, but what we know is services are doing really good risk assessments, and we would encourage them to keep doing that.
How can providers ensure the outcomes for clients, but also protect and manage their health and safety and their professional and personal life?
There's some really excellent resources that are available, firstly from New South Wales Health and also the New South Wales Small Business Commissioner and Safe Work Australia. We have a number of those on our website, and we'll be making sure that we put the links to all of those today because people need to feel supported and secure in their work environment. And what we know is that none of us are immune from the changes in our personal life. So thinking about our own personal well-being is incredibly important as well. What we know is that under the Work Health and Safety Act from 2011, employers must, as far as possible, provide a safe work environment for their workers and any equipment that they need so that their workers are not put at risk. We know that this has been a big part of the conversation about personal protective equipment, and we're working with the sector to make sure that people can access that where that's required. So we know that everyone is thinking about their worker safety and also people's personal wellbeing at this time. It doesn't matter whether you're in a government service provision or in a funded service provider. It's really important that people have regular access to the public health information and are encouraged to keep in touch with when that information is updated. We know that employers are consulting with workers on where they see risk and discussing those risks. Keeping a really open dialogue at this time is really important. And knowing that when people are working from home, we may have had flexible work for many years, but flexible work hasn't really meant that we've all worked from home at the same time. So whatever ways people can keep in touch with their workforce, whether it's like this through Zoom or phone calls, we find that that's going to be incredibly important, and it doesn't matter what sort of service sector that you're working in.
How do we identify and support groups who are at higher risk of experiencing sexual, domestic and family violence?
The opportunity that we have in front of us is to look at other jurisdictions and what's happening there. And what we know from international evidence is that we're seeing higher rates of family and domestic violence in other jurisdictions where we're maybe a couple of weeks behind the progress of the virus. So we're using that information. We're also working closely with the emergency services to make sure that we line up our data so that we're seeing any changes in reporting. We're talking to our Commonwealth colleagues about more information that may be coming through the 1800 RESPECT line so that we can also work out where there may be pockets of additional concern that we may not have considered before. But I think it's a really valid question to see what else are going to be the other indicators. I had a good discussion with Boxar yesterday, and they're going to be tracking very closely about increasing reporting, and we'll be able to target our efforts if we get more information through that sort of source.
And finally, will there be additional police and hospital support to respond to the increased levels of domestic and family violence? And what would that look like?
So we're thinking about that, and so there has been a task force pulled together that has both health, police and Department of Communities and Justice on it to be able to really track and monitor the operational responses, especially where there are increases. So that met for the first time on Tuesday, and we'll be able to provide regular updates to the sector about what's being discussed there. We also want to use it as a conduit about where the sector is seeing places that they think there needs to be more attention. We know that health resources are very much focused at this time on the virus, but we also know that they want to make sure that they're tracking the response from community. So we definitely have a health response, but we need to really focus on how do we support the community at this time. And I know the police feel the same way.
Thanks, Simone, for that information. That's really helpful. Before we finish up, I just wanted to let the sector know that DV New South Wales and other women's safety peaks are meeting regularly with government. And if you have any questions, to let us know, but to stay involved. But we wanted to ask you, Simone, if people do have issues, questions, where should they go? Where should they look for help?
I think the first port of call should be your contract manager, but we also have opportunities, and we'll put these websites and links up with the video where you can contact us through a support email about COVID-19. Really happy to take people's questions and really happy to put together some FAQs, because we think that that will really support people with the information that they need. So thanks so much.